The novel coronavirus COVID-19 is a new illness that was first identified in Wuhan, China in December of 2019, with patients reporting cases of fever and acute respiratory illness. Since that time, other countries, including the United States, have seen cases of the illness. As a diverse and globally engaged research institution with a world-class academic medical center, the University of Kentucky has been closely monitoring developments related to the COVID-19 outbreak and their potential impacts on the university community. The health and safety of our faculty, staff, and students is our highest priority. On the academic side, UK is one of many universities to move its classes online using channels such as Zoom, a video conferencing platform, as part of an effort to reduce the number of people on campus. It's all part of a plan to use social distancing to minimize exposure to the virus throughout the community, to reduce the caseload hospitals may face at any one time, alleviating the need for beds, personal protective gear, ventilators, and other equipment. I'm Kody Kiser with UK Public Relations, Strategic Communications, Marketing, and Branding, and I'm joined by my colleague Carl Nathe. On this special episode of Behind the Blue, we talk with UK Chief Communications Officer Jay Blanton about the work being undertaken across campus, UK healthcare, and across the Commonwealth to adapt to these challenging conditions, work to save lives, and continue to be Kentucky's indispensable institution. We would normally be doing this in the studio together, but in keeping with our current social distancing practices, we are doing this via Zoom. We are in 3 separate locations, and I am joined right now by UK Public Relations and Strategic Communications Carl Nathe, and also Jay Blanton is the Chief Communications Officer. So thank you both for being here with us, and we have a lot to kind of touch on to just give kind of a 30,000-foot overview of kind of where we are as a campus community, and also kind of what our process has been as far as UK healthcare and the work that they've been doing. So the first thing I'll ask, and I'll get out of the way and let Carl kind of jump in and ask some questions, but how have you been managing what I can only assume, Jay, is the massive volume of moving pieces and parts that you've had to deal with?
Sure. Thanks, Carl, and thanks, Kody, and hope you guys are staying safe and healthy. And it's good to see you, even if it's only virtual. Nice to connect with you guys. Again, miss being around our team as often as we could be in the past. I mean, it's almost cliche to say we're in an unprecedented period of time, but it's cliche, I guess, because it's true. I think we've been really fortunate, though, that we've got some leadership that I think is particularly well suited to facing an unprecedented challenge like this. And we have a president, Eli Capilouto, who has 40 years of experience in higher education and spent much of that time as a dean of public health. So I think he has a particularly deep and unique sort of vantage point from which not only to view a crisis like this, but to help us navigate it. Then you've got Eric Monday, who is, you all know well, is our Executive Vice President for Finance and Administration, who has literally logged over 1,000 hours in emergency operations situations and in an emergency operations room and center, which we can talk about here, as he worked at LSU for almost 2 decades and helped them manage and help lead their response to both Hurricanes Katrina and Gustav. So he has an approach, I think, to emergency management, crisis management, that really informs almost everything we do, and is you all I know have seen is really something to watch. So I think the combination of that kind of leadership, along with a lot of others like our provost Dave Blackwell, and just people throughout the institution, and Mark Newman, the executive vice president for health affairs, has been something outstanding to watch. And then we've got a great team that I think in our job, I heard an analogy the other day about the idea of a levee being this sort of elongated block of a flood, right? That you want the levee to hold. And I think our communications team is part of that levee that's helping hold back those flood waters and helping hold our community, our campus community together. At least I hope that's the role we're playing. I feel like it's the role our team is playing. So specifically to your question, Kody, sorry for the long windup. We have a couple of different people in our emergency operations center. We have stood up that emergency operations center, and that's got an interdisciplinary, cross-disciplinary team of folks from public safety, facilities, information technology, communications, marketing, across the campus, provost office, student academic life, people across the campus who are in there every day to support the ongoing operations of the institution. So that is one way that, and everything as best we can sort of flows up to that emergency operations center and then flows out in terms of approvals for purchasing, in terms of approval for healthcare needs and support, but also in terms of communication. So that's where we are trying to, as best we can, help coordinate communications that go both to the campus internally and then externally through the media and other sorts of platforms to the general public. And that's really been the structure that I think we've had in place, led by Dr. Monday, sort of put in place by President Capilouto, to help coordinate some of that communications. The other piece I would mention is early on in this situation, is in January, in fact, President Capilouto instituted a work group around coronavirus. So it started pretty early in the process, and it started, frankly, with our response to, we had a number of faculty coming out of the Christmas break, coming out of the holiday break, a number of faculty and scholars who were in China, which is where the virus was first detected, and so working through the issues of getting those folks back home and getting them the health care and going through the protocols they needed to go through. So we actually started that process, as I know some other institutions did. We started that process very early, and as President Capilouto always does, communications was at the table. We were at the table as we thought through that process of getting faculty and scholars home, and then later, as the virus spread internationally into Europe and then domestically, we had a number of students in places like Italy, in particular, that are education abroad folks who are just heroes of this. We're working to get students home, and we get to play a role in that, at least a support role in that. So I guess my point is the communications folks from our marketing team, from our PR team, from all the teams across our unit, as you guys know, have been involved from the very beginning. And now our role, I think, is to try to keep the campus informed as we make changes in a really fluid and still very evolving situation, but also to tell the story of UK, the things we're doing across the community, across the state, to support the Commonwealth and to help us get through this crisis.
If I might chime in, this is Carl, and we're here with Jay Blanton, Chief Communications Officer for the University of Kentucky. Our thanks to our colleague Kody Kiser, who opened this discussion up and is also facilitating it. Kody is much more of a technological whiz than yours truly, but we will work to the best of our abilities, right? All right. So my question to you, Jay, you used the term unprecedented, and driving through campus these last couple of days, whether I've been in the office on very rare occasions or not, but driving through campus, this doesn't even look like, say, spring break. This looks like, wow, what happened? And it really is a stark reminder of what's going on. But the good news is it seems that we've had great adoption of the guidelines for the COVID-19 virus.
Yeah. That's a good point, Carl. This is not where we wanted to be, but it's where we needed to be. And what I mean by that is Governor Beshear, who every day has been, I think, leading the state through this crisis, along with guidance from the federal government, particularly the Centers for Disease Control and Prevention, have been providing us with the information we need to make decisions about how best to keep our campus community healthy, safe, and ensuring their well-being. And early on, days are getting kind of a blur right now, but within the last few weeks, the best advice was to, as you all know, and as we're doing here now, to adopt things like social distancing, to self-isolate if you were had symptoms or suspected of having the illness or something like that. So within the last few weeks, there became the guidance to largely vacate the campus in some ways, with some notable exceptions. But that meant a couple of significant things. One, the majority of our workforce would be working remotely, working from home or in other sorts of platforms or situations. One. And then two was for our students to move to online learning or other sorts of platforms for the rest of what ultimately became for the rest of the semester. And then three, to move the vast majority of our students off campus so that we could ensure that appropriate social distancing measures. Can't really ensure that if you've got 800 people living in a residence hall and 2 and 3 or 4 people to a room. So that was what we needed to do to keep our community safe and to keep the larger community safe. So it's in many ways it's just sobering to go on our campus right now in the middle of spring, a time when we should be celebrating that inevitable NCAA championship run or getting ready for commencement. Students getting ready for finals, all the great things that are rites of spring on a college campus like the University of Kentucky. That's sobering and a little sad. At the same time, though, it is heroic, I think. Within the last week alone, Carl, by the end of, we're taping this Friday, March 27th, right? By the end of today, we will have helped move out, not me, but our housing folks will have helped move out nearly 7,000 students while also practicing kind of social distancing techniques. So they went through a whole process of, 1 or 2 at a time over a couple hour period, scheduling those folks, helping them move out so we could get them home to a safer place. And at the same time, we've got some students, probably 400 to 500, who are going to have to stay on campus. So international students who can't travel back for a lot of reasons. Students who may have some financial hardship, and for right now, this is their primary home. They're going to stay on campus. And what's going to happen now over the next several days is we're going to move them into 3 or 4 residence halls on the north side of campus, where they can each live 1 to a room, where we can lock down sort of public common areas, where we can provide sort of support and structure, and where we can also set up structures in place to support them in terms of dining from the student center, to-go dining. So that's Champion's Kitchen, which will be bustling right, around lunchtime, has become a to-go dining center. They're going to set up a one-stop shop, probably over in the Gatton Student Center, where folks from financial aid, folks from mental health and counseling can be student support for those students who are living on the north side of campus. So think about that, moving out 1 and 2 at a time, 7,000 students over the course of a week, then moving 400 or 500 students into a couple of residence halls so they can get the help and support they need. And then finally, I'll mention, think about in the span of about a week, moving hundreds, if not thousands of courses into a completely different format for learning, online or Zoom or Canvas or whatever that modality is. Faculty, some of whom have done a lot of online learning before, instruction before. We've got a lot of faculty who've been increasing our capacity in that over the last several years, but a lot of faculty have not done that before. So in the matter of a couple of weeks, figuring out how to do that, I think it just shows the concern and care that our faculty and staff have for our students. And I think it shows we talk about this being a community a lot, but I think it reinforces that even right now, where the community is not bustling like we want it to be, it still is a community. And I think that what's happened over the last few weeks only underscores that.
You mentioned the online classes and the alternative methods of learning, which, to what I've heard, is going quite well in the early stages. And this would have been the first week back for students from spring break, but right. We are doing it online. And Provost Blackwell, Dr. David Blackwell, who is our provost, the chief academic officer, is reiterating to faculty that the expectation is the same kind of academic rigor. Am I correct in that?
Yeah, that's the hope. I mean, and our belief. I think the reports we're hearing from faculty are really positive. That's not to say it's perfect. That's not to say there's not going to be hiccups. There are. But the vast majority of reports we're getting back is that the faculty have worked really hard with the support from folks like Kathy Kern, who leads our online learning efforts. Frankly, our own marketing team, Julie Balog and her team, who helped stand up a few different websites and portals for students, a Learn Anywhere site, a Teach Anywhere site, and even for our other employees, a Work Anywhere site. So portals for our faculty, students, and staff, and to understand how they can change their manner of work and learning. So lots of efforts have gone into that, but we're hearing really good reports. In fact, we had a story this week on UK Now that someone just mentioned to me, reminded me about this morning, that a history professor, Bob Rabel, who's been probably a member of our faculty for decades, had never taught online before, and he's in his last semester as a member of our faculty, teaches a film class now. They helped, Kathy Kern and her team helped him put that online, and he was reporting back about what a wonder. He'd never done it before. He's got kind of technological capacity like you and I have, Carl, which is to say not a lot. And so he was able to put that class online and do PowerPoints and lectures and show things related to that film class that he'd never done before. Now, we can't wait to get our students back, and I'm sure Dr. Regal feels the same way, but he got to participate in something that was new and different and innovative. And sometimes, you don't let a crisis go to waste, right? So those kinds of opportunities, those kinds of stories we're hearing all over the place.
Jay, I have a question about the University of Kentucky employees, many of whom are working remotely. I have a couple of friends that are in UK facilities, and some of them are coming in every day, that being the physical plant people, but some just coming in on occasion, also working remotely. But what about, if you will, some of the rank and file hourly employees that staff dining halls, that work in housekeeping jobs, that keep our campus clean and so forth? What is the mode for them, and how are they being, if you will, taken care of? Because salaried employees that can work from home, that's one thing, but right. People that work hourly, how are they being taken care of?
Right. Well, as President Capilouto and the provost, Dr. Monday, have, I think, strongly advocated, we want, if you can work from home, we want you to do so. That's the safest, best mode for employees. And fortunately for folks like us in PR and communications and marketing, and Kody sitting at a soundboard at his house, we can do that. There's a lot of folks who can't do that. You can't cut the grass from home, and you can't provide health care to people across this state, from your living room. So you've got what President Capilouto calls a lot of unsung heroes, people that we don't always think about, and that do their jobs every day, that things happen and you just assume they happen and you don't think about. And then what he also calls unseen heroes, those folks that you don't see every day, that we don't have visibility to, who behind the scenes make this campus run and operate. And even in a moment like this, where we're in a different mode of operation, still make it work. You still have to heat and cool buildings. You still have to maintain the grounds. You've got to provide technological support. Think about the thousands of students now who are learning online, some of whom maybe at home don't have internet access or broad kind of bandwidth access to be able to learn online, that need technology, that needed a mobile hotspot that had to get delivered to them in some way. And there's stories across our campus about how that happened. So that's going on, one. And then two, you're right, Carl, there are some folks that, because their work involves, sort of need to be on campus. We've got facilities and other folks that are sort of thinking about, okay, what are other things that people can do that we can repurpose, use them in other ways. And so that's going on across campus too. And so those kind of work plans have been put in place, and we're working through that over time. But I think you're seeing and hearing, I hope, a lot of stories of just incredible efforts on the part of people that we normally don't always think about or talk about, as we should, who are making this campus continue to operate.
Let me ask you this in terms of the campus and its operations, and I want to transition a little bit. You touched on it, but University of Kentucky Healthcare, UK Healthcare, under the leadership of our Executive Vice President for Health Affairs, Dr. Mark Newman, but all of the doctors, you said the doctors, the nurses, the staff people, when you're working in the medical field, they know this from every day, like Christmas time, there's somebody going to be working. There's Thanksgiving. We might be off on Thanksgiving or Christmas, but they're not. And excuse me, I think that's my computer. I got some email or something. But anyway, how are we doing with those folks? Because as you said, these are really heroes. They're on the front lines and they don't have a choice about it.
Yeah, well, it's interesting. We talk about, you're right. We talk about bad weather. The healthcare folks are the ones who are there. But think about right now, and someone else said this just this morning, and it really hit home with me. Our healthcare workers down at Chandler and our other hospitals within the UK healthcare system, they are literally at risk and are going to work, right? I mean, they're taking care of people who are sick. They're taking care of people who may have the virus and are testing them, or in a few instances, bringing them into the hospitals in patients with the virus. So our healthcare workers who are on the front lines every day. We use that sort of that terminology, but they are literally at risk. Their safety, their health is at risk, and they're showing up. And they're not showing up because they have to. They're showing up because that's their commitment. I mean, that's what they do. That's who they are. And I'll give you just a couple of examples of what they've done in the last couple of weeks that is incredible, that only exposes them even more. So within the last just this week, we've started a drive-through health clinic, a testing clinic at our Turfling clinic, starting with healthcare employees, those who are demonstrating some symptoms, so we can get them tested and assess whether they have the virus. 100 people a day rolling through the Turfling clinic, getting tested for the virus, stood up by this UK healthcare system. We now have in-house testing capacity. So it's not only to do the test, do the swab, but also test and determine whether someone has the virus. So hundreds of tests going through there a day. And folks in a little crowded little lab over in the standing side by side, they're protected, but standing side by side in a lab doing tests every day. Within the last week, we have completely changed the operating processes of the hospital. Dr. Newman and his team, Schwartz and others. So under the governor's guidance, which was the correct guidance, in order to get ready for what still may be to come, we have suspended or delayed or eliminated for now elective surgeries and procedures. So why did they do that? Freeze up beds. That hospital, 900 beds, is usually more than 900 people in that hospital. It's probably the busiest hospital in the state. But by suspending those elective procedures or surgeries, it's creating capacity in beds that we may need as this virus spikes. So it's that kind of stuff that's happening like that. Think about all the work that has to go in, 9,000 employees at a healthcare system to turn that around to do those sorts of things. It's an incredible, incredible enterprise.
Well, one of the things too that I think people, it's important to inform people about, not only does putting a hold on elective surgeries and procedures and things like that, not only does that free up space, but it also keeps people out of harm's way as far as being exposed. So if you're going to the hospital, and that's what people I think need to understand about some of our changes to our visitation policies as well. In that, we ask that people, we've changed it up to where when people come in, they can be there, but then as they leave, they need to immediately leave, and that's just in an effort to minimize their risk of exposure as well.
Well, you're right. It's that, Kody, and it's also this whole, we're learning all kinds of new terminology that we'd never heard before as a result of this crisis. But, the other thing that's talked about a lot, particularly in the healthcare setting, is what they call PPE, or personal protective equipment. So we're doing, that there are hospitals across the country, and we're not the only one, but everywhere are struggling, grappling with how to have enough personal protective equipment, the masks, the gloves, those kinds of things in order to provide the kind of care that we need to provide, but also to protect those healthcare providers. So these kinds of changes that we're making also are part of an effort to preserve that PPE so that we can continue to provide that life-saving care.
Right. I want to ask about something we touched on a few minutes ago. We talked about students and faculty and staff in China and in Italy. We have a university president who has a background in public health, relatively new in the terms of its physical space, emergency operations center in the last few years where we built at the 90, where we've done a lot of crisis training. We've all been a part of that as well. Nothing to this extent, nothing in this form. But you never know what you're preparing for. And also a leading healthcare system with UK Healthcare as far as our presence here in Lexington and around the state. But as far as our presence with this and our involvement, it does seem like we are uniquely positioned to play a role as a leader, if not a strong supporter here in the state. I know we have a governor who's been very visible with daily press conferences and updated information. We talk a lot about our town gown and our hand in glove relationship with Lexington, but how have we been able to work with our state leaders at this time in the efforts that they are making across the state?
I think Dr. Newman and the healthcare leadership down at UK Healthcare in particular have been on the front lines, so to speak, of that. They are in pretty constant communication and conference calls with state leaders, particularly our public health leaders, Dr. Stack at the state level is the public health commissioner. So they're talking continually with them and other hospital leaders across the state, because they're having to, look at, what are our PPE, what's our supply of PPE, those kinds of questions. What's your bed capacity? Are you planning? What's what Dr. Monday calls scenario mapping, thinking about what do the next few weeks look like, what the next couple of months look like as we think about what the trajectory of the virus might be, how that might impact our critical care kind of standing. So they are in constant communication with the governor, with his health officials in particular, about specifically on that healthcare sort of issue of how we stand ready to, this is we talk a lot about, this is why we're here. And the power of advanced medicine, those are taglines and brands. I get that, but this does sort of underscore why we're here. We are the leading advanced subspecialty care hospital in the state. So if you are critically ill, this is going to be the place to be. And we may have that kind of issue. So we've got to be ready. So preparation for that is ongoing, and that requires, I think, a lot of constant communication with the state.
Jay, beyond the healthcare, let's talk about on-campus events at the university. At the outset of the interview, you mentioned that the basketball team and so forth, they couldn't play in the SEC, they couldn't play in the NCAA tournament, which was heartbreaking to a lot of folks. But in the scheme of things, is not all that terrible or important when you're talking about people's health and life and death. But what about on-campus events at the university going forward in terms of, we're here in late March, what about April, May, and so forth?
Well, in accordance with those federal and state guidelines, Carl, that we've talked about some, we really aren't doing any on-campus events, anything that requires any sort of gathering of any size of people. And if you know President Capilouto, he is very strong on this idea of social distancing and what that means and why it's so important. And as a public health practitioner and scholar, he understands it even better than most of us. But he's led on that. So there aren't really campus events going on, and to the extent people can stay home, work from home, we're doing that, obviously, as you guys know very well. But what you do have, I think, going on is through our student and academic life areas, folks like Dr. Kirsten Turner, who leads that, runs that operation, which is all the student support kind of services. They're trying to think of creative and innovative ways to keep students connected. So, a lot of online and doing stuff virtually through Zoom, like we're doing this conversation now. I know our Office of Institutional Diversity, led by Dr. Sanjafis Price, she was talking to us this morning about how the director of our MLK Center, Jason Brooks, is on the phone with those students, holding his 3-year-old in his lap while he's at home talking to students. So we are trying to find ways to keep our students connected to community. I think the online instruction is going to be one of those ways we try to do that too, in some interesting ways. I think probably the most significant event that we're going to have to rethink and that we're delaying, not canceling, is commencement, which was going to be that around that first weekend in May, around May 6th. So what the president announced is we're not canceling commencement, but we're going to have to delay it a bit. We're still in a pretty fluid state with this situation, so we haven't talked yet about what that date might be, but we've got some folks thinking through that. We are going to have commencement. It does not delay someone's degree or their status as a graduate of the university. We're just delaying the celebration part of it. But the celebration is significant. So we're going to think through that and be back hopefully within the next several weeks talking about what a date might be for that.
Keeping on the academic end, while commencement is kind of a celebration for those earning their bachelor's and master's and PhD and professional degrees and so forth, and we're going to have to delay that this year. Right. But the next thing is the university, being the living, breathing organism that it is, the next group of students is very anxious to enter. And I'm sure the parents and guardians and grandparents or so forth are looking forward. Normally, they would be looking forward to coming onto campus and starting classes in August. Hopefully, if this thing abates and we get back to some kind of normal, that can still happen. But what about students that are in the process of they've either been accepted or they're waiting to hear whether they've been accepted, they're making their final decisions, that sort of thing?
That's a great question. I appreciate you asking it. So I think the leadership of people like Christine Harper, who's our Associate Provost for Enrollment Management, Julie Bailog, our colleague, who's Chief Marketing Officer, Taylor Breyer, who runs the orientation and sort of experience, they've done some really innovative things. So we're in the process in March right now, for instance. It's a critical time. We're getting close to that first-year class committing to the university. We have taken in March, we have a series of 3 merit weekends where really top-notch students come on campus and get to know us a little bit better, and we hopefully commit to the institution. So the first one, around the 1st of March, we were able to do, before the crisis really hit domestically. And Julie and her team videotaped a lot of those sessions. So by the time we got to that second one, last weekend, obviously the campus, we were at a campus a bit largely vacated, right? And we weren't allowing large groups to come on campus in order to ensure their health and safety. But they went to a virtual merit weekend. So 400 plus students, which is about what would happen if it was a physical on campus merit weekend. Some 400 plus students participated in an online virtual merit weekend. We've got another one starting today, Friday, March 27th, I think around noon. 300 plus students are going to participate in this virtual merit weekend. So they're hearing from the president virtually. They're getting to take a campus tour, I think, virtually, and staying connected to the institution that way. I mean, but it's just another remarkable way in which, on a dime, folks were able to pivot, make the best out of a tough situation, and try to give these prospective students who are facing their own sense of loss too, right? I mean, most of these high school students, they're taking classes online now. Their commencements and their proms and other kind of rites of passage have been delayed or canceled altogether. This kind of one-time, once-in-a-life thing. So they're going through some sense of loss too. But we're trying to give them an experience that gives them a sense of what a community this is. We talk about things being wildly possible at the institution, at the University of Kentucky, giving them a sense of what's possible for them at UK, and showing them that we can be pretty resilient. It's what we expect from our students, but also showing them, I think, most importantly, the kind of support they're going to have when they come to this institution. We're going to emerge from this, as Governor Beshear says, and it's going to be a new normal. I hate that term, but it's probably pretty apt right now. It's going to be a new normal for us. But we're going to emerge from this, and we're going to be here. I think what the University of Kentucky provides to this Commonwealth is going to be even more important than it was before. The healthcare we provide, the research, just to pivot for a second, Dr. Dean DePaula over in the College of Medicine, Lisa Cassis have stood up an alliance of researchers across the campus who are pivoting away from what they were normally doing and thinking about what are vaccines, what are approaches and therapies to COVID-19, to coronavirus that we could be investigating. That kind of work, think about that, that's going to be even more critical. And then I would finally argue the kind of education we provide at a place like this, the flagship institution of the state, as we emerge from this, as the economy needs to recover, having young men and women who are skilled, who are great communicators, who know how to work in teams, who can work across disciplines, that's going to be even more important. So the kind of education, service, and care we provide, I think, is going to be even more important as we come out of this crisis.
I wanted to ask you, in terms of, first of all, the phrase "never say never" comes to mind with this event, because who could have imagined? We've been through other things in our lifetimes, but this is rather unique, and really to change people's daily life to the extent that it has is amazing. We don't want to keep you too long because we know you got a busy schedule today. And Jay Blanton, the Chief Communications Officer, University of Kentucky, is with us. I'm Carl Nathe, along with Kody Kiser, and we're from UK Public Relations and Strategic Communications and Marketing. And anyway, Jay, in terms of other things we want to mention, maybe bullet points that people can remember, some key tips that you want to get across, and this would be to the large constituents of that. We have faculty, we have students, we have staff, we have alumni, we have friends of the university throughout the world. What is your message to them in this time?
Yeah, I think a couple of things, Carl. Thanks again for asking that question. Every meeting I'm in on this, virtually now, mostly, the principle is repeated at the start of the meeting. And that's that our first and top priority is the health, the safety, the well-being of our community. And the other principles revolve around, can we communicate often, transparently, openly with our campus community, good news or bad, to make sure they understand what's going on. Let's be transparent. And then let's work to return to whatever that new normal is as quickly as possible, but always informed by what's going to be in the best interest of the health, the safety, the well-being of our campus community, our faculty, our students, and staff. So I would say to our internal community, our friends and colleagues, that really does inform everything that you see President Capelouto doing, that you see the leadership team of the provost and Dr. Monday and Dr. Newman of the UK Healthcare doing. It really starts and ends with that principle. And then the final thing, and I think our folks know this really well, is we really are in uncharted waters. We're going to get out of this, but it's going to be a really fluid and dynamic situation for a period of many weeks, if not months. And even then, when we emerge out of it, it's going to be different. We're going to, again, I think the work we do, the education, the research, the service, the care we provide is going to be even more important, but the context is going to be somewhat different. It just is. So we're going to have to be flexible and patient and work through it. And that means a decision that gets made today might have to change tomorrow because the facts on the ground change. I mean, we started, remember, a few weeks ago with hoping that we could have a spring break and then go online with instruction for a couple of weeks. Well, facts on the ground changed. The trajectory of the virus continued to change and evolve. So that had to become the modality we were in for the entire semester. We didn't want to be in a place where the majority of our workforce had to work from home, but that was what was in the best interest of the health, the safety, the well-being of our campus. So we're going to have to be flexible and patient and learn to do different things. I'd much rather be with you guys sitting down in the studio in the Matthews building having this conversation, but we're doing it by Zoom. So that's a small example, but that's just the world we're going to be in. And that's what we're called to do. As I think, I'm biased. I'm a graduate of this place, worked here a long time, but I really do think UK is our Commonwealth's brightest beacon. And so that's what we're going to have to, it's the flexibility we're going to have to continue the work that is so vital to the future of the Commonwealth. So I think those are the two things I'd say.
All right. Thank you, Jay.
I think it's important to point out, too, that not only do we have people who are on the ground who are working through this right now, but also trying to look into the future to see how our response is going to change and adapt in the light of the idea that this could not continue for weeks, but for months, and that we've got people who are trying to kind of vision that out as we go forward.
Absolutely. I mean, I think a good example is the announcement President Capelluto made within the last few days about a hiring pause on campus. You don't want to do a hiring freeze or a pause, however you want to characterize it, but it was necessary in order to give us the sort of, just for instance, it's one example among many of the financial flexibility we need with the idea of keeping our community secure. I mean, making a bunch of decisions when we don't know what the world's going to look like in a few weeks to hire a bunch of folks would not be in the best interest of the existing community. So, I mean, it's those kinds of decisions that I think are being made, always, again, informed by that principle. I think we go back it's not just rhetoric. Every meeting I'm in on this topic, we even start with a restatement of that principle. Why are we here? Well, it's the health, it's the safety, it's the well-being of our community, and every decision gets informed by that. And so I think you see that through the announcements and the decisions that President Capelluto and his senior team are making, is that that's the best way to get back to where we want to be, and where we will continue to be, I think, is that institution that really is of, for, and with Kentucky.
Well, Jay Blanton, I want to thank you very much for being with us. Carl, thank you for being here and helping move this forward as well. I do believe that we are going to attempt to do at least once a week. We're going to try to do a special podcast. It may be the main one that we do that week. It may be an additional podcast that we do. We're also going to touch base with you again. We're also going to try to bring in some of these people that we've been talking about to give a little bit more of an up-to-date kind of touch base with those people, with Dr. Monday and Dr. Capelluto, Dr. Newman, possibly, as their schedule allows, and the work that they're doing as they have some time to do that, to be able to keep our community updated through this medium, along with the other ways that we talk to our community.
Great. Appreciate y'all doing it.
Yeah. So thank you very much.
I just want to say, hang in there, Jay. Keep up your great work. I know that sounds like he's the boss, but it's folks, if you could see what his life's been like, you'd have some great appreciation for it.
True.
Yeah, we got a great team doing a lot of good work, and you guys are certainly part of that. So thank you all.
Well, to both of you, I'd like to just say, stay safe and maintain your social distancing, and we will talk again soon.
All right.
See you soon.
Thanks so much.